All right. Well, it can be incredibly painful and extremely frustrating, and it affects 1 in 7 of our kids. We're talking about eczema, a condition causing some people's skin to become red, raw and inflamed.
9-month-old Connor used to be a sufferer, and we say used to because something pretty remarkable has happened, but it's not without controversy. Carolyn Robinson went to visit Connor's family to find out just what they're doing and why it's attracting the warnings.
9-month-old Connor is the picture of good health. But until recently, it was a very different picture.
When he was about 3 months old, he was covered from head to toe in a very itchy, red, inflamed rash that was oozing. It was hell.
A dermatologist diagnosed eczema, and so began a nightmare.
I remember the scratching, and I would go in the morning and the sheets would be covered in blood, and he would have blood in his ear. He'd have blood on his face and he was only 3 months old.
Parents don't want to see their children suffer. We couldn't do anything. We felt helpless.
The standard treatment is a combination of moisturiser and steroid cream, but they say standard treatments proved ineffective for Connor.
You could see the blood and the pus coming out, and we thought, we have to do something.
It got so bad that his skin started to get infected.
Desperate, they turned to the internet, where they found a South African doctor who was doing things a little differently. Dr. Richard Aron agrees moisturiser and steroid creams are the right weapons, but he believes antibiotics should be added to the arsenal, not taken orally, but as a cream, mixed by a compounding pharmacist and used longer term.
I believe in using a much weaker steroid for a much longer period of time in association with an antibiotic for a very, very important reason. Because when eczema children's skin gets infected with bacteria, the particular bacterium involved is called Staphylococcus aureus. And Staphylococcus aureus has great fun on eczema skin.
The family completed an online consultation with Dr. Aron, and he emailed a prescription that their GP consented to have made up. They say the results were both astonishing and immediate, but their joy quickly soured when they received a letter from their original dermatologist.
It was strongly suggesting that our GP stop rewriting that prescription because of their fears of antibiotic resistance.
Associate Professor ROHAN is not that dermatologist, but as a leading expert in the field, we asked him for his thoughts on Dr. Aron's treatment.
The first thing I'd say is that it's really great that somebody can help these patients, and I'm always very happy when that happens. The problem is these are short-term benefits, and we don't know what the long-term risks are. Another concern I would have is that depending on the age of the particular patient, there may be allergic triggers, and sometimes severe eczema in infants under 6 months, for example, can be a warning sign that there may be underlying food allergies.
For Connor's family, though, the benefits far outweigh the risks.
You'll do anything for your child, but when nothing works in the medical profession, you think, well, there's got to be something out there.
Wow, what a story. I can really relate to this because I have eczema and my little girl has eczema, and when it gets at its worst, you will do anything to stop that scratching and to fix the problem. So I can absolutely understand where these parents are coming from. I can also I get the perspective of ROHAN AMERATANGA. He's a very, very good specialist in this field. The interesting thing is there are no long-term studies, so they don't necessarily know that it doesn't work long-term. There's just no studies yet.
Here's what you do, though, when you're a parent with a baby in the condition that Connor was in. You want to help them immediately. And, you know, the long term, forget about it.
That's where you're at, isn't it?
Yeah, I just want my little baby to feel good tomorrow, a week later, and as parents, we'll just confront it down the track. And that's kind of the dilemma of parenthood.
And we're talking severe here, waking up bleeding, and in that kind of state, it must be awful. So just to reiterate that, your GP would have to rewrite that prescription for you to be able to have it. So it is quite a process, and that obviously have to be willing to do that as well.
Yeah.